Hello, everyone. My name is Suyan Sharma. I'm currently a resident at St. Peter's University Hospital. First of all, we would like to thank Heart Rhythm Society for allowing us to show our work. Our project involves the use of CHADVASC score to predict the occurrence of stroke in atrial flutter patients. CHADVASC score is a well-known predictor of stroke in atrial fibrillation patients. However, clinicians have also used it in atrial flutter to predict stroke. This have not been well studied. A study was done in Taiwan where they saw patients who presented with atrial flutter have an increased risk of stroke when their CHADVASC score is above 5. So we wanted to study the risk of developing stroke in atrial flutter patients based on their CHADVASC score. What we did is that we took our data based on the national inpatient sample of the year 2016, 2017, and 18, and we extracted those patients whose primary diagnosis is atrial flutter. We excluded patients who have any diagnosis of atrial fibrillation. In terms of CHADVASC score, we extracted their risk using the ICD codes such as stroke, any prior TIA, thromboembolism, and vascular disease, along with their other risk that pertains to CHADVASC score. And then we used the logistic regression model to create an association between their score and their risk of developing stroke as their outcome. Our sample size includes 539,444 hospitalization with a sole diagnosis of atrial flutter after excluding atrial fibrillation. With our logistic regression model, our numerical CHADVASC score is associated with a 21 increased risk of developing stroke. In terms of categories of scoring, a CHADVASC score above 2 have an increased risk of stroke occurrence. In addition, we also found that an increased CHADVASC score further increases the prevalence of a stroke in a dose-dependent fashion. As you can see the table on the left, a CHADVASC score above 2 has a significantly increased risk of developing stroke as their primary diagnosis. And the table on the right, a CHADVASC score of 1 and above have an increased risk of a prevalence of a primary stroke. In conclusion, our study shows that a CHADVASC score of 2 and above increases the risk of atrial flutter patients in developing stroke. This is different when we compare it with the study in Taiwan, where they've only shown a significantly increased risk of stroke when their CHADVASC score is above 5. In addition, our study is also supported by our dose-response relationship. From this, we recommend anticoagulation for atrial flutter patients with a CHADVASC score of above 2, which is similar to patients with atrial fibrillation. However, we are aware of the limitations of our study, which are retrospective in nature. In addition, we rely on ICD codes to extract data rather than manual chart review. Thus, further studies need to be done to confirm our finding in a prospective nature. So with that, thank you so much for your attention, and I appreciate your opportunity to share our work.